Yeah, well, we updated in our presentation the results of this already reported positive study looking at the outcome in patients that had undergone previous gastrectomy compared to non-gastrectomy. The original TAG study was a randomized phase 3 placebo-controlled trial in chemotherapy refractory gastric and GE junction cancers, comparing placebo best supportive care versus placebo plus trifluridine tapiracil as late-line therapy. And this has already been published in Lancet Oncology, Kohei Shitara's first author, and showed a survival benefit of 2.2 months with a hazard ratio of about 0.69 and improvement in progression-free survival compared to placebo with very acceptable side effects. Pretty much maintenance of quality of life. There was really not a decline in performance status, and actually the performance status decline slowed in patients getting active treatment versus placebo. So it's likely that based on the already published TAGS data that this drug will get regulatory approval as a late-line treatment option. So this updated presentation looked at a planned subset analysis of patients that had undergone previous gastrectomy, and about 44% of patients on the trial actually had undergone previous gastrectomy. We knew from the previous phase 2 study that PK was not affected by gastrectomy. Whether or not patients had gastrectomy, the PK of both the trifluridine and the tapiracil were identical in both patient populations. So this updated analysis looked at whether or not there's any toxicity or outcome differences in patients with gastrectomy. And indeed, the same results were seen. Improvements in overall survival was actually even a little better than the overall population, improvement in overall survival, again with a hazard ratio of about 0.67, improvement in progression-free survival. There was about a 10% higher rate of grade 3/4 neutropenia, but that didn't translate into reduction in dose intensity or treatment delivery. So I think this updated presentation reinforces that the drug is safe and has the same degree of efficacy, albeit modest, in patients that underwent prior gastrectomy.